right, folks. Now is the time for Headline or Hoax, that portion of the podcast where I read two headlines, and you, the listener, and the guests will decide which one is a true headline and which one is a hoax. All right, we got Honorary Dr. Drew and Dr. Steve ready here for Headline or Hoax. I'm going to read two headlines, one or two, and you tell me which one's real and which one is a hoax.
So are you writing down like the number we think is the hoax or the true?
Write the one that you feel is the headline, the real.
Okay.
The real. Yes, good question. And you, listener, you decide which one's the real headline. Number one.
Dr. Steve already knows the answer.
All right. Headline one is surgeon operated with penknife he uses to cut up lunch. Surgeon operates with penknife he uses to cut up lunch. Headline number two is LA surgeon uses lipstick instead of a surgical marker for incision line. LA surgeon uses lipstick instead of surgical marker for incision line. Let's think about those things. Now, as a surgeon, we do have to use a surgical marker, oftentimes to mark the operative site or mark a incision line. All right, let's give the listener 3 seconds to make their final deduction. All right, and let's do a little debate here. What are you guys thinking about which one's a headline and which one's a hoax?
I mean, it's so obvious to me.
So obvious.
So
okay.
obvious. The second one about the doctor lipstick
an
because,
LA doctor.
Well, because you from what I've heard about LA people, from what I've seen on like influencers and TikTok, like they are not shy about how they use their like makeup and lipstick and stuff. Like I could see something like this is a good idea. So
maybe if it's lip liner, maybe they use that to mark there. But like if it's true lipstick,
lipstick would like be a better like pen replacement.
Okay.
Maybe.
It sticks long.
All I know is the markers that we use to mark for surgery are sterile.
Right, they are.
Well, maybe you should try lipstick. It might,
Maybe you should.
might add some color to the
wax is probably good, right? Yeah, type of deal. I thought number one.
Okay, why is that?
I guess. Now, again, I'm thinking that this is some third world out in the Congo type of thing that some surgeon is, whatever, he would eat his lunch on some mission trip or whatever. And next thing you know, they don't have a scalpel or a knife and has to do some type of
gotta do what you gotta do.
It's the thing from like MASH with radar and the Tom Mix penknife type of thing.
So you went with show your answers.
I went with number one.
I went with number two, which was the correct one.
Correct.
It probably is.
All right. Are you ready, listener, for the big reveal? All right. So the actual headline was that a surgeon performed surgery with a penknife he uses to cut his lunch.
Well,
can you believe that, folks?
There you go.
You win some and you lose some.
There you go. Right there. Number one, right there.
And this wasn't actually in a third world country, unless you consider England a third world country.
Depends on the day of week.
This was in Sussex, where Brighton and Hove is, and a surgeon utilized a Swiss Army knife that he uses to cut his lunch to perform a thoracotomy, which, listener, is opening a chest with a Swiss Army knife.
That was like visualize.
How long did that take?
That is quite a cut.
Yes, with a Swiss Army knife.
Yeah.
They probably replaced the clock on the wall with a calendar. How long did that take?
Is it strange to me, though, that it's less weird to me that he used a Swiss Army knife for a surgery knife than it would be if he were to use a surgery knife to, like, make lunch? Like,
right.
to me, that sounds stranger to me.
You see him in the cafeteria cutting his apple with a scalpel.
That sends serial killer vibes.
I mean, they have, like, disposable scalpels. I've cut many of orange in the past with a disposable scalpel. Yeah, I mean, you do it and you toss it. You're not using it on a patient.
That's true.
Type of deal. But yeah, see.
Could you perform any of your surgeries with a Swiss Army knife?
Could I? Oh,
like
if I
an
had
emergency.
to, sure, yeah. I need a screwdriver. I mean, I need a power drill. I guess I need a drill. If I can get a power drill, screwdriver, I'm good.
Do you think he just wiped it off on his pants before? Like,
Probably
like rinsed it or something.
I mean, I wonder if it was like on a plane or something.
No,
crazy.
this was in the hospital.
It was in the hospital.
Right.
Okay.
So,
and did he get to?
the listener can now hear that anything you need for surgery, you could get at like a Lowe's or Home Depot, like
Right.
power drill, Swiss Army knife. If you need to do surgery, man,
They have
DIY.
not released the name of the doctor that this is, but they are investigating a Dr. MacGyver.
Yeah.
He used a Swiss Army knife and closed the wound with duct tape. But
Yeah,
it's just
I
circumstantial.
can't imagine that if he did that on a Tuesday, that he was operating on Thursday.
There is an investigation.
Unless it
Yeah.
went really well. Unless
Yeah.
like someone called in like, thank you, this duct tape's holding together real well.
Well, in the UK, they have that dual healthcare system. You have the the government system that you just sit on a list forever, and then if you want to pay, you go to the private system.
You get the scalpel or the Swiss Army
Yeah,
knife?
I mean
Which-
exactly right. Yes.
I have a hard enough time opening my mail with the Swiss Army knife. I don't know how someone opened a chest with that.
Yeah.
Just saying that had to have been a real sharp knife.
Yes.
Yeah.
Because most Swiss Army knives, like,
I mean, if it was
you
like
can
a good,
butter your toast with them.
Right,
Yeah.
exactly.
I mean, maybe if it was like a good Benchmade or something like that. I mean, that you could open somebody up with. but-
I think the real headline here is that's a really good Swiss Army knife. Whatever brand that is, that's the one you want to
Yeah.
get.
Feel free to sponsor the show.
Yeah.
But I think Al Capone would have had an easier time filing his way out of Alcatraz with the emery board than this guy
Yeah.
trying to open a chest with a Swiss
yeah.
Army
Yeah.
knife.
Yeah. Just push harder.
All right. All right, knock, knock, howdy, folks. Dr. Ben back here again. We all love our games. We're serious all day long, and then we need to decompress. And some of us are seriously funny. Dr. Steve and I are going to help officiate this game, a classic Hasbro game. We have honorary Dr. Drew here.
Thank you for that honorary status. I hope to make you guys
You've earned it.
proud
You've
when
earned it.
I had surgery. This guy,
Did you ever have aspirations of being a surgeon?
not even a little bit. Although I think doctors probably hate when people say this, but I loved the TV show Scrubs growing up.
Oh, I love that show.
Wow.
So
Coming back.
Yeah, that's the closest thing I've ever had to being a doctor.
All right, listener, this is the Dr. Ben Buzz Battle. Ben Buzz Battle. Remove as many of the 12 ailments in 60 seconds. And if it buzzes, just go on to the next one. We'll see how many you can do in 60 seconds. And we're starting 60 seconds on the clock. And looks like he is removing a funny bone.
Oh, there you go.
That counts. He's removing a funny bone
You
right
got that
now.
out? That's
listener. And the listener, it looks like
Butterfly.
butterflies in the stomach. He is going
Uh-huh.
for butterflies in the stomach, folks.
Are you shaking or am I having a seizure watching this?
Oh, move on to the next one. That buzz. We got a frog in the throat.
Uh-huh. Oh, dear.
Frog in the throat.
Uh-huh.
Oh, he did
Oh, he-
successfully remove.
Okay.
What was that?
Oh,
He is
Oh.
buzzing. The
Oh,
buzz
dear.
battle. The buzz battle. Okay.
Oh.
We'll let him come back to some if he doesn't get to those.
I'm going to need an ENT visit after this with the sound going through my headphones.
Wow. Dr. Drew here is
Oh. Oh.
okay.
Well,
How many
well
did we
done.
get? Well done. Well done. Dr. Drew, folks, successfully removed 3 ailments.
Mm-hmm. Another
Funny bone, butterflies in the stomach.
Another
Well,
5
you know,
years of
he's
surgical
fine,
residency.
right? You know, so,
Well,
yeah.
yeah, he may have to remediate.
Yeah, I think so.
How did I do in comparison to your last guest?
Well, he set a high standard, Dr. John. And so,
So not as good.
not
I mean,
as good, but.
But I
you're
think for
both very
comedians,
For a comedian.
you're probably in the top 2 to 3%.
There, okay,
of
there-
comedians,
Oh,
right?
yeah,
I would have a
comedian
low-
surgery.
I would have a
surgeons,
low
yeah.
threshold of comedians being able to.
You really should. We should not be given.
And that's why more people were receptive to a surgeon, me trying comedy, than they would be a comedian trying surgery.
Yeah, I mean, think about it. If you took, a plating set with plates and screws in it, and another pan of surgical instruments that had like rongeurs, chisels, scalpels, saws, and you took like Larry the Cable Guy, get her done.
Yeah.
He'd get nothing done, right? He couldn't do anything with that, right?
Right.
Nashville's funniest comedian can, he could replace a knee, do
Right.
a reverse shoulder
That's right.
type of deal.
Yeah.
Do you think Nate's gonna
Replace the shoulder.
Yeah, I mean, I know laughter is the best medicine. Laughter's
Unless you're
not,
treating gall or bladder incontinence.
yeah, laughter's not going to fix your torn meniscus. So I mean, that's.
I mean, if you laugh hard enough, maybe you'll. I don't know. I always forgot that a meniscus isn't a bone because, like, maybe it'll snap it back into place.
yeah.
Yes, it is the best medicine. Unless you're treating gall or bladder. I did call the incontinence hotline today. They told me to please hold.
Yeah.
So,
Okay.
all right. We appreciate you all for listening. Make sure to depress that subscribe button with your thumb or index finger.